All right, apparently I'm too long-winded for this section. So to continue, influenza, SARS, and hantavirus. Influenza has numerous influenza viruses that affect it. That's why getting one flu shot doesn't last you forever. It's always kind of a crapshoot of which flu is going to be the big strain that year. SARS is the coronavirus, and the HPS, of course, is the hantavirus. So to describe them a little bit, influenza is very common, typically seasonal. The very young, the very elderly, the pregnant, and immunocompromised are at high risk. Those people can have some pretty ugly outcomes with influenza. There is an immunization, provided that it's the right strain that is picked for the immunization. Whereas with SARS, this was an outbreak originated in China. It was brought to North America in the early 2000s. No community-acquired cases have been reported since. However, there have been approximately 8,000 cases with an approximate 10% mortality rate during that time. It's very possible that it could have another outbreak. SARS has not been eliminated, so it's definitely something that could occur. Most patients have a known history of contact with the SARS infected individual. The hantavirus, also called the sin nombre or no-name virus, this is a virus that's contracted through airborne dust containing rodent saliva and or dropping particles. It's fairly rare, and most cases occur in the Four Corners region of the United States at a mortality rate of about 37%. So in the very dry, deserty areas is where the hantavirus issues. Influenza, generally mild but can be very severe, leading to pneumonia, most commonly seen as malaise, fever, muscle and joint pain, and a cough. That's the true influenza. SARS is fever and pneumonia. Hantavirus, there's a couple of stages. Basically, it starts out to look like the flu. Second, it starts to creep towards cardiopulmonary issues with pulmonary edema, leading to ARDS, shock, and then multiple organ failure. Treatment for the three is usually supportive and IV fluids. Hantavirus people may need aggressive resuscitation. All of these you need to take efforts to protect yourself. So if there's anything that remotely makes you think infectious respiratory disease, self-protection has got to be a huge priority for you. All right. Patients sometimes complain EMS providers that their physician refused to prescribe antibiotics for them or for their children for earaches, sore throats, and respiratory infections. Antibiotics are ineffective against viruses, and many of the upper and lower respiratory infections are actually caused by viruses. But why have antibiotics lost their effectiveness? They're overprescribed. We are overly sanitary in some respects in the United States. We use the heck out of antibacterial soaps and alcohol, hand sanitizers, and we use these antibiotics like they're going out of style. And what it actually does is it makes the bugs stronger. So that's why they constantly have to develop new, bigger, and better antibiotics, is they have to fight off various bugs. MRSA, methicillin-resistant Staphylococcus aureus. That is a bug, a bacterial bug that we made, basically, because we continued to overdo the antibiotics, and it mutated a strain of bacteria to make it so it's now resistant to some of the strongest antibiotics that we have. There are bacteria out there that do not respond to bacteria or to antibiotics. So one of the biggest problems that leads to this is that people will get antibiotics. They're told to take them for 7 days or 10 days, and they only take them until they start to feel better. And when they only take them until they start to feel better and have a couple days left, what happens is that bug never is fully killed. It's weakened, but yet stays alive enough that it can start to mutate and become a more resistant bacteria. So that's where these things come from. Lung cancer. Lung cancer generally caused by smoking, exposure to asbestos, and there is a genetic predisposition to it. It's often not diagnosed early enough to cure, and there are two different general types, small and small cell. Other things like radon gas can cause it. Radon comes from the natural decay of uranium. Radon is very prevalent actually around the Midwest area here. It seeps into the homes through cracks in the foundation. So there's another major cause, something that we should definitely keep in mind. The 5-year survival rate after diagnosis is only 15.8%. There's usually not a lot of signs and symptoms until the disease gets fairly progressed. So non-small cell accounts for about 87% of the cases. Small cell spreads very quickly, whereas non-small cell is a little slower. The staging of cancers, not just lung cancer, but all cancers, is staged based off of how far along it has progressed and whether it's metastasized. Lung cancer is commonly spreads to lymph nodes, the brain, the adrenal glands, liver, the bones. You may have stage 0 cancer, in which stage 0, most of the cancerous cells are located in the innermost lining of the lung and have not spread. You go all the way up to stage 4, in which it basically has spread throughout the entire body. So those stages are fairly common, to represent most of the types of cancer, whether they be, stage 0 very early in the process, stage 4 very late. It's possible that you'll be transporting some lung cancer patients that are going to chemo or radiation. Some facilities don't do those, particularly radiation therapy. Most facilities do chemo, but don't do radiation therapy. You could be having to transport patients around a bit. Commonly, they're complaining of things like shortness of breath. Usually have quite a bit of pain. They'll may have pulmonary effusions, which are fluid pockets in the thoracic cavity, similar to basically a pneumonia. Common to see them develop pulmonary embolisms. And then people who are undergoing treatment, both chemo and radiation, typically get extremely ill, more so with chemo. Chemo tends to have the most sickening effects on people, makes them very nauseated and vomiting a lot. They will often become quite thin and frail. Treatment for any type of cancer is really a butt kicker because treatment for cancer affects all the cells of the body, not just the unhealthy ones. So with a lung cancer patient, we do run that risk of having a patient that's in the process of dying, and patients may be on hospice care and have do not resuscitate orders. Kind of a sad situation, but it is a common cause of respiratory distress. And then patients may have a respiratory depression and a hypotension caused by high doses of a narcotic medication, whether that is A, for recreational purposes, or B, for treatment purposes. These people that have cancer in particular have lots of pain, and therefore they're on lots of pain medication. They may be on something called a PCA, P as in Paul, C as in Charles, A as in Adam. PCA pump, which stands for Patient Controlled Analgesic, where they have a button they can push on their little IV pump that gives them a boost of medication for the pain. It's very controlled. They can't just constantly hit the button. They get like 1 or 2 or 3 boosts in a certain time period. Otherwise, they're getting kind of a constant flow of it. But as they have pain that flares up, they can hit the button and improve that. Cancer patients also generally have a large variety of other issues, behavioral changes. They may have mets to the brain. Metastasis is where pieces of cancer have essentially broken off, moved to other parts of the body, and now started new cancers in other areas. They'll be typically hypoxic. A lot of them are on O2, a lot of side effects of medications. They may also have bone mets, bone metastasis, where the bones fracture very easily. Cystic fibrosis, it's a relatively rare, affecting only about 30,000 people in the United States, genetic disease of the secretory glands. So basically it causes increased secretion of various fluids. A lot of the organs are effective. We only generally think of the lungs because that's the most critical. But the digestive tract is also affected quite a bit. The pancreas, in the pancreas, mucus blocks those ducts, and therefore the pancreas can't do what it's supposed to. It can't secrete the various enzymes that it needs to. Typically they have problems with stools and whatnot. So we have these very thick secretions, almost tarry-like, that can cause life-threatening infections and problems with breathing. These days, life expectancy reaches about 30s. Used to be most children died of it, or very early adults died of it. Some patients now are capable of living longer lives than that. Constantly, medical science is improving. And we're really going to treat mostly the signs and symptoms that we get. So we may have patients complaining of some difficulty breathing. Oxygen, IV, because the fluids will help thin that out. CPAP may or may not be appropriate for these patients. Probably it'd be a good idea to contact medical control, see if they would like to do that. Nebulized bronchodilators can also be very helpful for these patients. So that again is going to be a choice of medical control and whether albuterol is appropriate or not for them. All right. So in summary, acute and chronic respiratory problems can be life-threatening due to impaired ventilation and oxygenation. Respiratory distress can quickly progress into respiratory failure and arrest. The problems of COPD and lung cancer, asthma, pulmonary edema, hyperventilation syndrome, infectious diseases, and cystic fibrosis are probably our more common respiratory problems. We can recognize the signs and symptoms and obtain a relevant history and develop a clinical impression. And quick recognition of the level of distress and intervention to restore and maintain ventilation and oxygenation can be life-saving. In some cases, we will administer very specific treatments, and in most, it's very supportive for airway, breathing. And you need to have an ability to empathize and calmly interact with a patient that is in critical condition.